Understanding your shoulder replacement options. We'll discuss the two options available: conventional total shoulder replacement and reverse total shoulder replacement. Indications for total shoulder replacement. When the cartilage on the rounded part of the arm, humerus, is damaged, it can lead to bone-on-bone contact with the shoulder joint, causing pain and limited mobility. To determine the appropriate approach, your doctor assesses the condition of the rotator cuff, which stabilizes the joint during arm movement. If the rotator cuff is intact, your doctor will proceed with conventional total shoulder replacement. If there's a rotator cuff damage, reverse total shoulder replacement is typically recommended. Conventional total shoulder replacement. Number 1. Procedure. The damaged rounded part of the humerus is removed, creating a canal where a stem is placed to hold a new ball-shaped implant in position. Number 2. Shoulder restoration. The shoulder area is cleaned up and a polyurethane cup is securely fixed in place to restore smooth fluid movement in the joint. 3. Stability with intact rotator cuff. Conventional total shoulder replacement is suitable for patients with an intact rotator cuff to ensure stability during arm movement. Reverse total shoulder replacement. Number 1. Procedure. The round ball implant is attached to the shoulder instead of the arm, and a stem is placed in the arm housing the cup implant. Number 2. Enhanced stability. Reverse total shoulder replacement provides more stability for patients with a damaged rotator cuff, compensating for the weakened tendons.